Okay, my name is Mike Ormian. My particular role and interest within the co-production group is to represent people with profound intellectual and multiple disabilities.
Hello, I'm Julie and I joined the co-production group in 2016. At the time we were applying for a personal health budget for our adult daughter who has profound intellectual and multiple disabilities, and my role in the group is to represent other people in similar circumstances. Our daughter started her personal health budget in October 2017 and it's totally transformed her life. Before she had her budget, she was very withdrawn, she was very depressed, she didn't want to get up in the morning, she didn't want to do anything, she was really in a very dark place. But having a personal health budget enabled us to recruit a team of support staff who we knew she would really like, and they've just brought her back into the world. She's interested in getting up and doing things every day. She's happy, she's cheerful, she's enthusiastic about life, and it's worked really, really well for her.
For our daughter, the most important thing and the best thing for her was our ability as a family to take on the role of recruiting a new team for her. We knew that she needed particularly good people that would be able to understand her communications. So we set about, as a family, we set about recruiting the right people for her. They've done a fantastic job. And I think in the process, we were also able to identify the goals. With the help of her team, actually, they helped us to identify a lot of the goals, and they're the ones that have been doing the hard work to achieve them. So we, I suppose, had to find our own way through the maze, which was very difficult. It took a long time. It took us about 17 months in all to get from start to finish. But it was certainly all worthwhile.
If I could say one thing to people who manage personal health budgets, I would say have a clear pathway to work to. So you know the process, but also the person who's applying for the budget knows the process and has some idea of the timescales and where they are on that pathway.
I would say that they really must make sure that a personal health budget is value for money, and the only way they can do that is by monitoring the process, making sure that our goals are met in an appropriate way, and that the CCG needs to take a proactive approach in ensuring that goals are being met, and in that way we all know that it's value for money.
The one thing I would say to somebody who was thinking about having a personal health budget is to take ownership of the care and support plan. Do that by writing it yourself or with the help of a close friend or relative, so that it really reflects your life, your needs and your hopes and aspirations. But you also need to be 100% committed to seeing it through, because at the moment, because it's in early stages, it isn't an easy process, and it needs that total commitment from you and your friends or family.
Right, well I would say that if you're going to apply for a personal health budget, think very carefully about your staffing, how you're going to deal with staffing. If you decide to employ the staff yourself, you are an employer, and that carries all sorts of legal implications for you. We've actually decided to use a third party to employ the staff, and that's taken a huge weight off our minds. The challenges are actually many and varied. I suppose in particular it's staff recruitment, trying to find the right staff. We live in a rural area and it's quite difficult. So recruitment, training of staff, getting staff trained, particularly if you only have if you recruit a new staff member, that person has got to go through a whole training process, which is very costly.
I think the most positive change about having a personal health budget is being able to recruit the right people, a super team of people that suit our daughter. She likes them, she trusts them, they enjoy being with her, and she enjoys their company every day, so she wants to get up, She wants to do things. She wants to be involved fully in her life, whether it's at home or going out. They've learnt her communication because it's a stable team. They're with her regularly, and they have a wonderful time, and it's transformed her into a different person.
Set the goals that need to be achieved, and the team work together with us to do that.